What diagnosis are we talking about? Fecal incontinence, stress incontinence, and urge incontinence. Stress incontinence, examples of that would be if you're leaking with coughing, sneezing, standing up, having leakage every time you lift something up or bend over. That's an example of stress incontinence. And then urge incontinence is when you're that person that is not necessarily having a lot of leakage, but you feel like you have to go all the time. You're in the bathroom every 20 minutes, 30 minutes, every hour, and it's not just because you drink a ton of coffee, which can be a contributing factor, but often we actually see a mix. So many people come to us and they're not just urge incontinence, they're not just stress incontinence, it's a mix of the two, and that's totally normal. Other things that we treat with pelvic health and physical therapy: prolapse, pelvic pain, pelvic floor pain, nerve pain, sciatica pain, pudendal nerve pain. Those are things we treat, but it's also SI pain, SI dysfunction, piriformis syndrome. Those are all pain that have to do with your pelvis. And really it goes beyond that. Your pelvis is so connected to your lumbar spine that a lot of our patients that are having lumbar pain are having dysfunction in their pelvis, and it's very much related. Seeing quite a few patients, men's health, post-prostatectomy cancer patients. So these patients have had their prostate removed because of cancer, and following that surgery, they're often dealing with a little bit of pain and incontinence, erectile dysfunction too. But those are some of the things that they can be coming in with, and that all the things we talked about today can also be of help for them too. Okay, so let's take a look at our models here. Beautiful models today. I wish I had a male pelvis, but I just have a female pelvis, so we're gonna have to make it work with that. There's actually not that much difference when it comes to the anatomy we're gonna talk about today between the male and female pelvis. I have two models here. This one includes the muscles, and this one does not. But I like this model because I can actually move the bones around. So this is the front of the pelvis, so you know what you're looking at here, and you can see the spine. That kind of helps you, a little indicative of that. And there's the back. So you can see the spinous processes here, and you can see your sacrum. So your sacrum is this triangle bone here. And at the very bottom of the sacrum, you have your coccyx, or your tailbone. That's right there. And you have your two big hip bones there. Those are often referred to as your innominates, or you can call them your ilium bones. But those are your two big pelvic bones right there. So again, here we are from the front. And this is your pubic bone here, the pubic symphysis. Then your two ischial tuberosities. We often refer to those as your sit bones. And this is all one big bone right here. These two big innominates. Okay, so that's mostly what we're looking at for bones. And let me go ahead and point out. So again, we're from the back here. There's your spine. These are your SI joints. We talk about the SI a lot in pelvic health. It's the joint right between your sacrum and those ilium bones. That's why it's called your sacral iliac joint. SI joint. That surface where they connect right there, and actually I'll pick up this model so you can see it better. So I can actually take it apart, and I don't know if you can see that there, but right where they connect, that flat surface, that's your SI joint. So that's the basic bones of your pelvis. Let's talk a little bit about the muscles. I only have your pelvic floor muscles on here. When we deal with pelvic health, we often address much more than just your pelvic floor muscles. But a lot of us have some familiarity with those other muscles, like your hip flexors, your quads, your hamstrings, your adductors. All of those are very involved with pelvic health. But the ones that we're less aware of course, is your pelvic floor muscles. And you've probably heard that term and wondered, where are my pelvic floor muscles? What do they look like? What are they doing? So let's talk about that. I like this view the best for seeing that kind of bowl shape, dome, that your pelvic floor muscles form. Your pelvic floor muscles are a group of muscles. It's not one specific muscle, it's a combination of muscles that all work together to kind of form what I like to call the bottom of the can. So the can being your trunk, and the sides of the can would be your abdominal wall, your anterior abdominal wall, your posterior abdominal wall. They kind of create the edge, the sides of that can. And your pelvic floor, that dome that we're looking at here at your pelvic outlet, that's the bottom of the can. So there's all these specific muscles that we're not going to go into today, but they all come together and form this dome shape at the bottom of your pelvis. One of the main functions of the pelvic floor is that you have inside of your trunk or your abdomen, you have all these vital organs, your intestines. They're all weighing down and they're all being held up by that pelvic floor. Your abdominal wall is holding it in this way, but that pelvic floor is holding that bottom of the can, right? And inside the can, you have a lot of weight with all those intestines, bladder, your liver, all that is pushing down, right? Gravity is pulling that all down. The other thing we should definitely look at is that in the middle of your pelvic floor is all your orifices, right? So you have your urethra, vagina, anus, all there, right? That kind of leads into the next main and obvious function of the pelvic floor is to control those. If you want to stop the flow of urine, let's get into incontinence here. If you want to stop the flow of urine, you're going to squeeze those pelvic floor muscles to put pressure on the urethra, to put pressure right on that urethra so that you can stop that flow. So that's another pretty obvious function when you're looking at these muscles. It makes sense that they would be involved in that process.